Medicine at Queen Mary University of London. I'm a paediatric respiratory consultant at the Royal London Hospital, running a difficult asthma service and with a long-standing interest in air pollution. I'd like to introduce our other speakers. First of all, Tom, could you introduce yourself?
Sure, yeah, thanks, Jonathan. Hi, I'm Tom Parks. I'm the Senior Air Quality Officer at Camden Council. So I lead Camden's air quality programme to try and improve air quality and protect public health.
Thank you very much, Tom. Next, we have Sam Rostom. Sam?
Thank you, Jonathan. Hi, everybody. My name's Sam Rostom. I'm a Programme Director in NCR's ICS, leading on our asthma agenda.
Thank you. Welcome. And finally, Abby Whitehouse.
Hi, I'm Abby Whitehouse. I'm a paediatric registrar that works with Jonathan as a paediatric clinical researcher.
Thank you very much, Abby. You're an IHR clinical lecturer. I think that's right as well. Okay, can we have the next slide, which is just a housekeeping slide? This is for all you. As this is a sort of open Teams meeting, if everyone can make sure that they're muted, so we don't hear any extraneous noise. This is being recorded. So if you're talking, speaking, please note that this is being recorded, and if there's a problem, then please note that. We are open to, obviously, to questions. There are two ways of doing this. One, actually during the talks themselves, you can put up a hand, and if we notice it, we will answer the question if it's related to that ongoing talk. The other way is via the chat. There's a group chat, and those questions will be fed to me at the end, and hopefully we can deal with those as a group. So I think we can move now to in conversation. So it's over to you, Abby.
Thank you, Jonathan. Okay, so I've got a set of questions that we've got on air pollution and paediatric respiratory health. So Jonathan, you've been involved in air pollution and its health effects research for over 15 years now. What first got you into this area of research?
Yeah, it's interesting. I mean, as a researcher, you move along different paths, and some sort of very small things can deviate you into in this case, to air pollution. It was just hearing about a talk at a conference at the European Respiratory Society by someone called Ken Donaldson, who was the leader, was sort of the father in the UK of particle research. He was working up in Edinburgh, I think it was, and he was giving a talk on ultrafine particles and health, and it sounded so weird to me that really inspired me to think about that and sort of turn my research. But I actually was, as a young researcher, always looking at airway cells from very young babies, and sort of washing them out of the airway and looking at them under the microscope. And I suppose because subconsciously I always thought I always noticed that they were very clean. And when I started looking at cells from the airways of children and adults, they had little black specks in, or full of black specks. And I sort of realized that those black specks were actually bits of inhaled particle pollution. And so, yeah, that set me along that path of both looking at the effects of pollution on the airway cells, but also linking in epidemiological data to air pollution and looking at, for example, new onset preschool bees. So yeah, it was just one talk I heard about. I didn't attend. Someone told me about it, which inspired me to go along that route.
Which is excellent, because you've now inspired a whole set of people following in your footsteps, me being one of them. We see, and you've mentioned the WHO guidelines just as you in your introduction, and we quite frequently see that air pollution levels in the UK exceed the WHO guidelines. What are your reasonings behind why we're managing to do this quite frequently?
Yeah, I mean, I think, the UK, as many other countries in high-income countries, took their eye off the ball after the sort of Clean Air Acts of the 1950s and 60s. I mean, there is still a generation around who do remember the smogs of the 1952, 54, 62, I think, the smogs. But they all disappeared, and we had clean air, and then it was assumed that because the air was, looked clean, that it was clean. But clearly it wasn't. In the UK, I don't think the traffic is any worse than any other city in Europe, but the mix of vehicles were more heavily weighted to diesel, which tend to produce certainly more nitrogen dioxide and probably also more particles for each kilometre driven, mile driven. And that was a result of political decision to try and, well, with the aim of decarbonising the fleet or reducing carbon emissions. But it was very clear at that time that that there were going to be health effects, that this was going to be a problem. I presume it was hoped that the government or technology would come up with a solution to this, but it didn't in many, many years. So we have a lot of traffic on our roads, lots of diesel. And that's driving a lot of pollution. Industry, of course, is not is locally an issue, but it's much less of one than pre 1975. So yeah, the key issue for individual exposure in urban areas is certainly emissions from cars and other vehicles.
And moving away just from the emissions, we know that the Ella Kissy-Deborah case has finally highlighted the risk of air pollution exposure to children with asthma in particular, but other respiratory conditions. What's the epidemiological evidence that underpins this?
Yes, I mean, I think that the Ella case, it just shows you the power of one case, how that can influence policymakers and actually resonate with the public, both in the UK and also globally. It's mentioned, in many other countries where air pollution as yet is not being put on the death certificate. So Ella, unfortunately, tragically died of asthma, and there's absolutely no doubt that air pollution played a role in the severity of her disease. Because, I mean, she lived on the South Circular Road, and so was exposed to illegally high levels of nitrogen dioxide, almost certainly particles, on a day-to-day basis. Yeah, but the actual Philip Barlow, who was the Southwark coroner, he very nicely reviewed the evidence and took scientific evidence from a range of people, Stephen Holgate included, who was a major contributor. And that evidence is overwhelming now that, the big epidemiological studies, so large survey studies linking disease or the onset of disease, if children and adults are followed for several years, to some sort of marker of locally generated pollution, something like the distance from your home to the nearest main road, or some model where the emissions from the roads are modelled near your house or school. The evidence is very, very strong that it's associated with new onset asthma throughout the life course, so preschool, school age, adult asthma as well. And then when you have asthma, it's associated with worsening of the inflammation that is driving the symptoms, and therefore worsening of increasing the risk of severe outcomes such as hospitalizations and tragically deaths from asthma. And I should say that for some reason the United Kingdom does particularly poorly in asthma outcomes, and we have the highest prevalence of asthma. But even if you adjust for that, we have disproportionately more deaths in children and adults from asthma. So it's sort of hidden, not quite a hidden disease, but I would suggest it's not taken as seriously as it should do. And certainly the Ella case focused on asthma as a major disease, and secondly, the importance of air pollution on a day-to-day basis and long-term in making your outcomes worse if you have asthma.
Yeah, and I think conversations like this and weeks like this where we're highlighting all these actions is really important. And now that we've got this evidence and research, what should researchers like yourself and me and other people be focusing our priorities on next?
Yeah, Abby, well, I could ask you what you're going to focus. Tell me what you're focusing on.
Interventions. So where can we go? What interventions? At the moment, the evidence for most interventions are quite limited. We know that we can reduce cars on the road, that will probably help, but what about all those other interventions that we think about? And I think that's certainly where I think our research priorities should lie at the moment, to prove that we can actually make a difference through reducing personal and wide-scale pollution levels.
Yeah. I mean, I think I would agree with you there. I mean, one thing that the coroner did identify was the need for the medical profession and allied health professionals and anyone involved in asthma and respiratory interactions with patients to be able to talk about air pollution, actually mention it as an important trigger of their attacks, episodes, or the control, and that in itself is quite a challenge because in medical school we weren't taught about air pollution. It's not really in any sort of continuous professional development program, so I think people feel very quite inhibited for doing that. So that's one challenge. But then the question is, what do we talk about? What, apart from saying air pollution is bad, what should we say to our patients? And I think that's a big challenge. There's no doubt there are things that we can do. If, for example, we know tomorrow is going to be a high air pollution day, that could mitigate your effect. But we don't have the full evidence yet. In a way, I think it's a bit like the story about masks and COVID. When we came into the pandemic, it was still unclear about masks. No one had done even the basic research on masks in wearing in as a public health measure, and then it became very clear that was a very, very important measure. So maybe we don't need to have the huge studies. We need sensible advice, and then and communicate that with our patients. Tell them about the uncertainty, yes, about whether the evidence is sort of not there, but they seem sensible. I think that's probably something we will need to do, because there are some sensible measures that you can do without affecting your day-to-day ability to work and move around the city or go to school, that seem appropriate. But then we need to catch up and deliver the evidence about which of the smorgasbord of things that we can do is the most important. So yeah, I would agree. Clearly, we still have to act as advocates, all of us. So if we're talking about air pollution health effects, in the same way as when we talked about smoking and passive cigarette smoking, or smoking in cars and children, we all have to act as advocates for the obvious effect, which is to reduce emissions from our roads one way or the other. Of course, it's up to politicians to work out the best way of doing it without impacting on economic growth, but absolutely that is possible. And secondly, we've also got the climate change agenda, and both the mitigation strategies, reducing exposure from reducing emissions from the roads, and climate change mitigation strategies are pretty closely aligned. I think in virtually everything, something that reduces carbon emissions will result in reductions of emissions from roads. There's some areas where there's a bit of debate, such as wood smoke. Burning wood is probably better for carbon, but it still produces particles and gases which are injurious to health. So there's still a way to go. So I think, yes, interventions, and finally, I suppose understanding more of the other non-lung effects, non-heart effects of particles. There's still emerging evidence on neurological effects, effects on obesity, on the developing fetus. There's some very good studies there, but not at the sort of depth that we have for a lot of the other respiratory and cardiovascular outcomes. So I think the more effects that we see, they can be added into the cost-benefit analysis of actually quickly doing something to reduce individual exposure at the population level.
Exactly, and I think starting those conversations is really important with our patients, and we're seeing in Tower Hamlets how well it's received, actually talking about it, because it's the first time that someone's brought it up in a clinic appointment. I think it is really quite important, because there's increasing media and public interest. I mean, if you go back even to when I started doing my PhD back in 2014, there was a lot less interest from a media and public's perspective in air pollution, and particularly its health effects. And I think there's been big, massive reports like the RCP, Every Breath We Take, back from 2016, and none of those really talked about how we lower pollution. It just talked about the health effects. I'm going to put you on the spot. If you could pick one local level intervention, we don't have enough evidence for at the moment, but if you could pick one local level intervention, what do you think it would be?
Well, it depends how local you want to be, Abby. I think it's very encouraging that something that has been done immediately is essentially the old diesel stock has to be removed from the road as quickly as possible. So the extension of the ultra low emission zone to the borders of the South and North Circular, it should have gone really to the borders of the M25, I would argue, really makes it uneconomical to drive a diesel vehicle. And of course, you know what the problem was with diesel vehicles is that they last a long time. If you add a little bit of extra tax on them, just road tax, then you know the cost of the vehicles will fall, and people just buy them and still run them. So they just have to stop being driven. So that's one thing I think will make a difference. But there are other things that we've got these low emission streets. I know that a lot of people have supported them, and I certainly support them. There certainly causes some people inconvenience, and again, it would be nice to see the personal exposure evidence that they're reducing exposure. Almost certainly they do. If your street is quite a rat run or heavily used, it will certainly reduce exposure. But some hard evidence would be nice. But we still can generate that. So I'm talking about new sort of established things. But if you ask me a wish list, clearly electric vehicles and hydrogen, if that works out, but alternative powered vehicles, absolutely. So we need to roll out the infrastructure for charging in London. If you live in most streets, you don't know where you're going to park, and changing over to an electric car is not. It should be not. Isn't easy. It should be easy. So we need to roll out that infrastructure where no matter where you park, in an electric car, you can charge it. So that would be it. And if you go to, for example, to Germany, all new houses, these new built houses and flats, must have fully provisioned electric charging. So other countries have sort of switched on to that. We need to do that urgently. So if I could click my finger, we can have electric charging in all places that people would park their cars, and then say all cars have to move to electric. I think that would be great.
I think you are. I think you're right. I think we're on a back foot. You know, Amsterdam with their cycles, the rest of Europe with their implementing of the electric charging points. I think we need to catch up. But starting the conversation and talking and being advocates for our patients, like we do with smoking, all of us would encourage people to stop smoking. But I'm not so sure all of us would encourage someone to get rid of their diesel car. So I think. No.
I mean, we do it. I mean, we are obviously, as clinicians, we are very sort of cautious, and we don't want to make people feel guilty. Often people are trapped in, in disadvantaged circumstances. We need to understand, the limitations of what people's own actions are, and that's why it's important that policy has to be nationwide. But yes, for vulnerable individuals, I think we need to at least do our best to try and protect their health. And I should say, I mean, now it's post. It's coming up to it's post 2 o'clock, I think, GMT. So the WHO limits are not embargoed anymore. So there are substantial reductions in PM 2.5, PM10 particles less than 10 microns, and nitrogen dioxide. And I suspect that with those new limits, a large proportion of London, at least, and other urban areas are going to be living in levels injurious to the health. So these limits have substantially fallen, and that's going to be even really more of a challenge to government to do something quickly.
Exactly. Time to make some changes.
Absolutely, and I think that this day is a good start. It's important. And it's important that the clinicians, allied health professionals, managers, and the NHS take a lead in this and really, and take this forward. When we look back at from 10 years from now, it's going to be a very, very different situation. And people looking back at this will say, well, why aren't they moving far quicker than they did? So we need to keep that pressure up.
Exactly. Thank you, Jonathan.
Thank you. Thank you, Abby. Thank you. Okay, so I'm very happy to introduce our next speakers. So if we could have the slide, and over to Tom and Sam.
Thank you very much, Jonathan and Abby. That was fascinating to hear and very inspiring and empowering, hopefully. I'm going to get some slides up, but just to say thank you very much for coming today. Really excited to talk to you all with my colleague Tom, who's our air quality lead, around how local authorities can work together with the NHS in improving air quality for children with asthma. And let me just get those slides up. Can you see those?
Yeah, they're on the screen.
Wonderful, thank you, Tom. So we'll be setting out in this presentation why we feel the partnership approach is so important, particularly with local authorities around this agenda for children, and what some of the key benefits are for that sort of working relationship. As well as how we'll be working together in NCL on our asthma agenda, and of course in line with the requirements of the imminent asthma bundle I hear is landing possibly tomorrow, what we'll be doing next in North Central London together. So why is the partnership so important on this agenda, and particularly around air quality? And I always think it comes alive for me, and I'm sure, Tom, when I look at this graphic from Stanford Social Innovation Review, and if you look at the non-healthcare factors there, so 80% of those drivers, the socioeconomic, physical environment and health behaviours, it does become really clear that we need to support the support of other sectors in impacting on these drivers. And the local authority, of course, plays a crucial role in this. And I'd also include public health in that too, which now sits with council function. And Tom, I'm sure you can say some more really about sort of the responsibilities that councils have in relation to air quality, and why we've kind of cut across together this agenda and have these sort of shared objectives.
Yeah, thanks, Sam. I mean, clearly there's lots of individual factors within that list there, and they're also sort of closely interrelated. Local authorities clearly have some influence over most of those, one way or another, whether it's education or employment. Housing clearly is a crucial factor in determining, as a determinant of respiratory and cardiovascular health. So obviously there's a role for local authorities in trying to manage some of the determinants of asthma, and in particular for children and young people. But as well, we've kind of heard about how over recent years the understanding of the impacts of air pollution on health has evolved a lot. I mean, currently local authorities have worked to statutory regulations for improving air quality, which are sort of based in legislation which is now 26 years old. And historically, authorities have mostly focused on reducing pollution levels. And it's been kind of all about the numbers, reaching a certain pollution target within a borough, and then sort of following a fairly strict set of actions within a local authority area to try and achieve those targets. And it's been, in my view, slightly disconnected from the real world health experience of people living their lives in Camden and elsewhere. So what we've tried to do in Camden as an authority, and in partnership with Sam and North London partners, is to really make sure that we are embedding public health outcomes in our strategic approach for improving air quality in Camden, so that what we're doing and all the effort we're putting in with our limited resources is focused on directly achieving improvements in public health and reducing the effect that air pollution has on people. And obviously, pediatric asthma is one of the key health outcomes that we need to focus on.
Lovely, thank you very much, Tom. So clearly sort of lots of benefit working together. And working with local authority leads, we've been able to develop this kind of whole system approach across North Central London, which would be absolutely impossible without the expertise of our partners and leaders like Tom and others in different bits of the system that will all contribute to impacting on those outcomes. And it's also been a real opportunity to maximise on the impact of our work. So, one example that Tom and I were talking before we sort of kicked off this is us coming together across this really important campaign. So we've been able to kind of develop shared messages You know, Tom, I know, has been in contact directly with schools and head teachers in relation to his role in air quality, but absolutely, as he was saying, about kind of linking those to the health outcomes for our asthmatic children and others. So hearing them for these messages from different parts of the system, I think kind of almost turns the volume up on them and enables that influence and influencing and galvanizing the system and other partners. And I think it's really reassuring for our residents, actually, that we're working together and not in silos. And as I said, sort of hearing for our residents and certainly families and parents of children with asthma, hearing those key messages said by different sectors, I think makes them more credible. And with all the noise of kind of, you know, information overload, I think that's a really important piece, that the credibility of this messaging to the public and our residents is so important. And as ever, there's so much learning, an opportunity for learning between partners. I mean, having Tom as part of our network and supporting us within this work has been fantastic, and it's really given us some insight and understanding about the impact of air quality, but importantly, what we can do to mitigate and how we can help our residents and our patients to do that. So there's a lot of opportunity, I think, for sort of educating our asthma system through leaders like Tom and inputs from other bits of the system that are able to share their expertise, so that we develop this kind of, you know, collective understanding of asthma, the drivers, and absolutely the interventions that we'd want to see. Tom, I'm sure you've got more examples of the kind of how it's helped you in your world being part of our sort of network.
Yeah, I mean, it absolutely has. I suppose you pointed out the fact that it's reassuring for residents to see that we're not working in silos. I mean, it's quite difficult to avoid doing that sometimes. Local authorities are obviously enormous organisations with lots of different teams working on very specific things, and similarly, you know, other partners within you know, the NHS and clinical commissioning groups. I think having that sort of interlinked relationship through this type of partnership working makes sure that we are able to embed consistent messaging across all different strands of our work. So from an air quality perspective, through our partnership working with Sam and co, you know, we've been able to include fundamental messaging and signposting about things like smoking cessation, about alleviating fuel poverty and improving housing conditions, which, as we know, you know, those are both clearly other significant determinants of respiratory health and asthma. But also from kind of an overarching perspective, we have much better access and clearer insight and guidance on interpreting public health data. So, you know, the linkages with Camden and Islington's public health strategy team means that we're so much better able to keep on top of the latest set of information about how asthma rates in children and young people in Camden vary by ward, and in relation to things like deprivation in certain areas. And, you know, we can kind of relate that back to our understanding of air quality in the borough. And it just allows us to reprioritise and focus our efforts to improve air quality in those areas and for those communities, which clearly, you know, are most vulnerable and would benefit most from having this type of partnership approach.
That's great, Tom. So how can we work together on this agenda? And we've been sort of at this for some time in North Central London, but I think a key mechanism of this approach is a really strong and vibrant asthma network. And that's kind of strong partnership approach and good representation from a range of sectors, as Tom said. So, you know, that's air quality, that's housing directors, public health directors, education colleagues, a whole host of different kind of bits of the health system make up such a strong kind of response to that, and all those brains kind of thinking about what the best strategic response is has been really well received in North Central London, and we did this really by sort of building relationships based on that shared ambition and framing within our outcomes, and took a really pragmatic approach, I think, a couple of years ago, with a round of sort of partnership workshops, including local authorities playing a key role in developing our sort of logic model and our approach for asthma. And that really gave us the opportunity, I think, right from the get-go, right from the start, of co-producing our plan and identifying the overlap of our organisational priorities, and where there is mutual benefit to work together. Clearly on this agenda, there is real benefit. not least for families and young people. And it also helps us make clear the role that each organisation can play in supporting improving outcomes for asthma, and the agencies, all agencies, see themselves as part of that strategic solution. And involving Tom and his team has been really, really important in having access to that wealth of expertise on air quality, and support our network and all our members with our understanding, and therefore then our ability to empower patients to mitigate and manage, and in turn sort of support kind of other council initiatives around air quality that we perhaps wouldn't have been alive to as part of our network. But having Tom there and other local authority leaders there, I think joining up on some of those initiatives really optimises their impact, and that's been a real sort of benefit for us, I think, in developing our strategic ambition together. And we're able to hold each other to account there. It's all of our responsibility, and it doesn't then feel like such a lonely world that you're in your one agency trying to solve it all, because as we saw from that initial pictograph at the top of this presentation, it would be impossible for a single agency to solve this, and we have to work collectively. Tom, I'm sure you've got more to say on the sort of work of the network and the role that you've played for us, I think, in providing your expertise, really. I mean, even in this campaign, supporting us in developing some of those key messages linked to your objectives from a council perspective.
I mean, yeah, I think I suppose one key example that springs to mind as kind of an outcome of the partnership working and sort of having access to expertise and also sort of passing on some of the air quality messaging to the healthcare sector, I suppose, is that I mean, for a bit of context, Camden and City of London have been working on this programme over the past 3 years with funding from the Mayor of London to reduce avoidable air pollution from engine idling. So, you know, vehicle engine idling is obviously kind of a relatively small portion of overall air pollution in London and other cities, but it's completely avoidable, generally speaking, and it's often centred around schools and hospitals and GPs. So it is a risk to the health of people visiting those locations, but also, you know, children being driven to and from school as well. And we've kind of plodded away as a local authority in partnership with other local authorities in London to try and make some progress on this. But through the partnership working that we're talking about, and through this kind of co-sharing of sort of ambitions, I suppose, and having a sort of a consistent overall objective, you know, we've been able to work with hospital trusts and through, you know, the NHS London Senate throughout the city for them to then adapt and kind of take our campaign much further than we would ever have been able to do it ourselves as a local authority. And we've seen that, you know, their kind of involvement and their adoption of the campaign messaging that we have about something as simple as leaving your engine running has reached a lot more people than we could have reached. So I mean, that's just one example. And over the past few years, through my sort of involvement in Ask About Asthma and in partnership with North London partners, we've been able to focus on other issues like indoor air quality, and, you know, how that relates to housing quality and fuel poverty and smoking cessation, all those kinds of things. So yeah, I mean, again, it's kind of reiterating the huge benefits on both sides for having a partnership approach. So, you know, we're able to get our air quality messaging out to the general public through many other means than we otherwise would have been open to us. And, you know, we've heard earlier on in the conversation between Jonathan and Abigail about how, you know, the inquest and the subsequent coroner's report following the inquest into the death of Ella Deborah has highlighted the role of local authorities, central government and the healthcare sector in making the public aware of the fact that air pollution does affect health. So, you know, clearly that underlines the importance of this kind of partnership work.
Thank you, Tom. That's yeah, really, really helpful to note that. I just thought this would be helpful when we're talking about our sort of strategic approach and our sort of priorities in North Central London. This is a bit of an overview of our kind of whole system strategy and our outcomes really in North Central London. And you'll see clearly around outcome 2, the links there with air quality. And part of ensuring this is embedded across the partnership is by leveraging very senior leaders to endorse and mandate the work, really, and give us all permission, I guess, to work together around a collective priority. And often we, when trying to work in partnership, every organisation has their own kind of priorities. So it's difficult, I think, to navigate that. So coming and coalescing around some shared outcomes has been a really helpful way of ensuring that we all prioritise this work. So we, as part of that kind of partnership development, we took this plan to each of the local health and wellbeing boards at the councils, recognising their local subsidiarity, really, and decision making, and knowing their populations and the resources they have locally, to provide us with that endorsement at the most senior level. So, council chief execs, directors of public health, directors of children's services, all the senior leaders for that patch and that geography are around the table where they sign up to this. And actually, it's a really easy sell. I mean, I know I'm preaching to the choir in this webinar, but actually, who doesn't want to improve health outcomes for children and young people? I think that's the easy sell. But it's just it's providing them the evidence and highlighting, I think, where the interfaces are and the opportunities and benefit is to working together that have allowed us to drive this through, really. So having been to those health and wellbeing boards and children's trusts and wherever you can get the senior leaders in a room to agree on this kind of shared ambition, we went there. And got a sign up, and I think that then gave us permission as a whole collective system to ensure that this became a priority. And I know for our councils in North Central London, children's health and asthma specifically is a key priority for a number of them, and that is through our work of highlighting just how important it is, and that children are still dying, as Jonathan said at the top, and that is unacceptable. And I think when you put that in the face of these people that really do care about our children, young people and families, that's really, really hard. That's really hard to hear without doing something. So I think that had been a really powerful process, and we weren't able to do that without the might of our sort of partnership and our members, as Tom had said. So what next? So we've been sort of talking about this, especially in the last few months, Tom and I, all the excitement about the campaign. So one of the things we have been doing across the last few weeks, including coming here together to sort of co-present, is developing those kind of those messages and continuing to sort of promote those key messages around the links of air quality and health, and highlighting, I think, primarily why this is so important. And utilising our partnership approach, including, as Tom sort of referenced earlier, moving into thinking about sort of indoor air quality now as well, and kind of wider environmental links and poor housing and obviously links to deprivation, and identifying sort of further collaborative opportunities across the health sector and local authorities. And I know we've been talking much more recently, and certainly in line with the bundle, I think, which is helpful in that it makes really clear, I'm hearing, and really explicit, that need for partnership working, and a focus on air quality and other wider determinants. So thinking then about taking it one step further, not just in highlighting with our members about the about air quality and the links with asthma and what we need to be doing as a system, but thinking pragmatically about what that looks and feels like. So, developing, accessing national resources, but also developing a suite of local resources with the input of Tom and his team for our clinicians to provide that education and understanding, so that they understand for themselves, but more importantly are able to support our patients and our young people and families with mitigating. I mean, personal story from myself. So I'm, my daughter is asthmatic, sometimes has some real challenges with her asthma. And even just as a mum, listening to some of these messages from Tom and and the team around his expertise, we have changed her walking route, because I understand now that that's part, that is one mitigation. And I want all our families to know and understand that and empower them, I think, to feel that it's not something we just have to sit back and accept, that actually we can all, both as individuals and partners and regionally, do something to improve this this situation around air quality. Tom, have you got anything to add around some of the other work you're doing? I know you're doing lots of exciting things in your neck of the woods as well.
Yeah, I'd say, I mean, we kind of saw at the beginning, so that with the infographic, how many different areas there are which have a kind of an influence on asthma rates. Where I kind of feel that we're fairly early in the process. Obviously, we have a good link between the air quality team and other partners in North Central London. But there are so many other parts of the council which have an influence one way or another on the health of people who live and work and study in Camden. So I think incrementally we're going to have to work through those different teams, build the relationships, and then bring them also into the conversation. So, for example, you know, we work with some of the teams that deliver sort of fuel poverty awareness, as I've mentioned, do kind of housing visits to focus on housing quality and how that affects health. But there's teams in Camden Council which work on you know, private sector rented housing. There's teams who deal with the maintenance specifically of Camden's own housing stock. We have, you know, there's teams which work in business development and economic development, and you know, all of these different parts of the organisation can have an influence, whether that's through encouraging new best practice in trying to avoid air pollution, or whether it's through you know, raising awareness among people who for example work in a restaurant about how their exposure to cooking fumes from a gas stove or from a wood oven or charcoal grill can affect their health, or the health of, you know, customers. So there's all kinds of things that we can be doing and we need to be doing to ensuring that the messaging that we're talking about gets out to the, you know, the wider population as a whole. Because as we've seen, asthma is so prevalent. There's probably a lot of people who wouldn't necessarily present to a GP or another practitioner with asthma symptoms, either in themselves or their children, for one reason or another. So it's making sure that if we can't get the messages out through air quality messaging or through healthcare messaging, that, you know, we have other people in an organisation and in other organisations who are upskilled enough to be able to get those messages across. And just, I mean, one kind of final point is that we touched on climate earlier on in the presentation, or in this session, and that's going to be kind of a key frontier, I think, between air quality and climate going forwards. As we see climate changing and as weather conditions get more extreme, we would expect to see there being sort of more extreme events in air quality as well. So ensuring that sort of forward-looking sustainability plans for local authorities also have a consideration about how air quality and public health you know, needs to be integrated into climate adaptation and that type of thing. So there's a lot of future relationships yet to be developed.
Exciting times then, Tom.
Yes.
I think that's it. That's it from us. Thank you.
Thank you very much for that. Thank you both, Sam and Tom, for that very, very interesting conversation, and I hope the audience found it as interesting as I did. Yeah, there's some questions, but just to clarify, the new WHO guidance, which was released 20 minutes ago, the EU limit, for example, for fine particles is 25 micrograms per meter cubed over an annual basis. They're taken enshrined into UK law. The old WHO limit for PM 2.5 was 10, and now it's going down to 5. So the nitrogen dioxide annual mean nitrogen dioxide was 14, which is the same as the WHO old guideline. That is now going down to 10. So I'm sure, Tom, that means that you've got a lot of work to do.
Yeah, better get off the call.
That means most of Camden is probably now well in excess of legal limits. So I think it'd be interesting to know if these new WHO limits will be enshrined into UK law. So I think that could also be a driver of doing something, but we shall see. There's some questions. First of all, I suppose I can open question one, perhaps to Abby. what strategies can individuals pursue to reduce the pollution they breathe? And that's specifically thinking about masks and maybe indoor air purifiers, which have received a lot of attention recently. What's your view on those?
I think, well, both of them are things that have been suggested as a way to reduce our own exposure. Masks, we all know that they definitely reduce exposure to viruses and bacteria. The guidelines are there with relation to COVID. The evidence is very limited. There's no real life evidence about it, and certainly what you want is one of those ones that's got a proper filter on, like the N95 masks that we see. And the question is whether or not walking around with one of those or cycling with one of those is practical. So I think there's definitely more research that's needed to find out whether they're useful. We know that they would reduce it, but we've got no evidence behind it at the moment. So I think it's something we should all be thinking about, and hopefully we'll pick up on it as a research study in the future. And air purifiers, again, we know that they work. We know that if you put them in a house or a building, that they reduce the particle load. But again, how much of an impact that would have on health is quite a difficult thing to quantify. But certainly we know that, and I'm sure Tom knows from all the work that he's done in the local authorities, that if we improve air quality within schools and ventilation in schools and buildings, that we reduce particle load there. And I think that's where they have their main priority, is putting them in big buildings and reducing particle load there, rather than in the home, where they're probably a bit expensive and unneeded. Possibly just reduce how much you burn your toast and how much you burn your roast dinner at home is probably going to be more effective than an expensive air purifier.
Yeah, I think that's very interesting. I mean, it does highlight, both Tom, both all of you emphasise the importance of the indoor environment, and I think we shouldn't lose track, because some of the inequalities that we measure in health, it's not an amorphous mass. There are definitive things that contribute to that, and poor indoor air quality, I think, is something that we should also not lose sight of. When we talk about pollution, it's not just particles from combustion. You can have bioaerosols from molds and various other things. And in my own clinic, I've just two days ago, someone who told us about a horrendous house with total damp, total moldy, and seems to be no possibility of moving. So I think that it clearly is not just outdoor and indoor. Question for Tom and Sam about their school work. Could you just tell us a little bit more about what you're doing in schools?
So and I know Tom's doing a whole host of other things, but from a North Central London perspective, so we've been rolling out asthma-friendly schools right across North Central London. So part of that is ensuring that they have an awareness of their role as a key setting for children and young people, and supporting them in terms of their sort of health management of long-term conditions. So working in partnership with schools, to make sure that they see it as a shared challenge. My background is safeguarding and child protection. So in much of the same way, sort of, 10 years or so ago, we all sort of agreed that safeguarding was everybody's responsibility. We're trying to do the same thing really around asthma, that it's everybody's responsibility that works in and around children and young people, and schools play a fundamental part of that, not least in terms of their education, but also in terms of the provision they have on site with emergency inhalers, registries of those children in place, and all the things that you would want to see kind of robustly managed for looking after those children in schools. So we are rolling that out in North Central London with an ambition that all of our schools are asthma friendly. And hopefully, I think Georgie's just put the link there for information on the schools guide, which gives you a kind of a checklist really, and lots of helpful resources about how you'd go about doing that. But I know Tom works also really closely with schools, particularly around air quality and the education elements. So maybe you have to say some more.
Yeah, so I mean, from Camden's air quality and transport perspective, we sort of take a twofold approach on trying to reduce exposure to air pollution for schools. So I mean, one part is sort of physical interventions. So that includes things like healthy school streets, which are, can take many forms. But for example, it might be a timed road closure outside a primary school, which is designed to discourage ultimately parents from driving their children to and from school if there's an alternative mode of transport they can take to get there, but at the very least, it prevents children being exposed to pollution from idling vehicles right outside the school gates. So, that can help to improve air quality outside and within the school environment. But also, we try and raise awareness among pupils and teachers and also parents as well. So I mentioned earlier on our campaign to try and tackle vehicle engine idling. In many ways, that's just a gateway conversation to get people thinking more about vehicular air pollution and about how air pollution is so intrinsically linked to the health of children and their learning outcomes as well as their health outcomes. But we also, we're trying to work more closely with head teachers and our network of head teachers within Camden. So, there's kind of weekly school bulletins which go out to head teachers, and we use that as a way of providing guidance about things like Ask About Asthma Week, the Asthma Friendly Schools program, because we know that school social media networks probably are a lot more influential within the local communities than the council's own corporate Twitter. So I think it's much more meaningful for us to build a relationship with the school and for them to be passing on messaging about, how people can travel healthily and sustainably, as well as, things like indoor air quality and other factors which affect overall exposure to pollution, both indoors and outdoors. Whereas, the council's own Twitter has something like 35,000 followers and, there's 250,000 people living in Camden. So I think probably it's much more effective to build that relationship with the school than for us to be just for the sake of it putting things out through a corporate channel.
Yeah, that's very helpful. And just to remind everyone, if they remember their highway code says you must not leave your vehicle idling unnecessarily. So this is not something new. It's definitely it's actually enshrined in law. So I think it's not some sort of irritant that councils have dreamt up. It's some actually essential for public health. In terms of impacts, Tom, I suppose one question is you're doing some doing low emission streets, etc. Are you capturing any of the impacts, the health benefits? I mean, it's a very difficult question, I'm sure, but how are you assessing impact? And I mean, the other side of the coin, of course, when we're talking about LTNs, is are you pushing traffic around? The traffic density remains the same, but it's just shifted around a bit differently.
Yeah, I mean, that's an absolutely vital point. I think it's one that local authorities will definitely have in mind when coming up with these types of schemes. I think there's no point in doing something if it just displaces a problem or just intensifies it to make things much worse for a certain group of people, particularly if they're people who are already most vulnerable to the effects of air pollution. I mean, in terms of monitoring and sort of looking at the outcomes of these types of projects. So, as you said, it's extremely hard to be able to portion or attribute a health outcome to a specific single transport or air quality intervention. I suppose we, as I mentioned earlier on, we are trying to keep much more sort of closely aligned with health outcomes, whether that's asthma rates in children, young people in wards within Camden or within lower, super output areas. So much more sort of geographically granular public health data where it's available to us. But in terms of our measuring sort of the actual air quality impact of these types of projects, we use various different types of pollution monitoring, both NO2 and increasingly for particulates as well. And we're trying to ever sort of improve and develop our portfolio of monitoring so that we can more effectively evaluate the specific impacts of a particular scheme, whether that's over the course of a day or a week. So, for example, the impact of a timed school road closure isn't necessarily going to manifest itself in like an annual mean pollution concentration, but you might be able to see a distinct change in sort of peak traffic air pollution levels, which we get from real-time air quality monitoring. So we're trying to, we do make sure that we have monitoring both within the areas that we expect to see a benefit in air pollution, but also we try and have a good coverage of other areas where there's likely to be a displacement of traffic, so that we can weigh up the sort of the net balance of changes, both adverse and beneficial for air quality for an area, and then make a decision about whether it justifies being turned into a permanent scheme or being replicated elsewhere, along with getting feedback from the communities which are affected by these types of things.
Yeah, I think that's a good, and I think actually the evidence, the WHO evidence is very clear that we don't need to now prove health outcomes. We need to show reduction in exposure. That's enough in itself, and that's we don't need to show that the change in asthma attacks or hospitalizations, which would need many thousands of people being sort of included in that reduction to see statistically significant effects. But if you could show a reduction of 20%. Or 10% even. I mean, any reduction of personal exposure is going to be beneficial because we know that it goes down and effects sort of go down to almost zero. One for Abby. What do you suggest for patients complaining about the impact of mold? There we are.
I think this is another point where we really have to put our foot down and advocate for our patients, and providing information for them on how to go back to their housing officers and their landlords and support them with that process. Unfortunately, it's whether or not I think someone mentioned dehumidifiers. Yes, they probably do help. It's going to reduce the dampness, but at the end of the day, it needs to be the source of the mold that's sorted, and that's quite often something that the person living in the flat or house can't do by themselves. And we as health professionals and councils and local authorities need to be able to support these families to move or to have the rectifications put in place for the buildings. Even just providing a letter from us can help to a degree, but housing stock I know is so limited in London. It's a really difficult situation, and someone's got to live in all of the buildings. So unless we have all the money to fix them all up, again, it's a lot, the money at the end of the day, and the support of the local authorities as well as us.
I mean, I guess to have that question just on that line, do you think, I mean, it sounds like the levers the clinicians and allied health professionals have to people who can affect change, like, even if they, moving house, or if you have a severe asthmatic on a main road, how can we improve those levers? Because sending off a letter, that obviously, Abby, it's part of your duty, but often you never see anything again. Is there any role for trying to improve that? Do you see any way we can do that?
I mean, from a North Central London perspective, Jonathan, I think that's where, again, coming back to having that sort of partnership approach and having that representation at that kind of asthma network, where the kind of strategic planning and implementation is taken from that point. So, we've got representation from directors of housing. So getting asthma even on their agenda as a thing to think about, I think, is an achievement to start with, and having them there and recognising their role in that. And we have had conversations kind of, around policy and supporting their thinking around sort of, borough level housing policies about prioritisation in terms of moves or housing repair work that needs to happen, where we would advocate and be saying, actually, given that you recognise your role in this and the impact that it has on children and young people, we would want to see them at the top of the pecking order when it comes to somebody going in and resolving those damp or mould issues, or indeed a move, as well as linking in with with some of the VCS and other kind of support arms of the local authority around their, just looking at sort of fuel poverty and groups like Shine that can play a key role in advocating for children, young people and families living in those situations, but also supporting them with ways that they could mitigate in the meantime. So it's sort of slow and steady work, but I think step one is ensuring that housing and key decision makers recognise the role that they play in this agenda.
Thank you. That's very nicely put. Just to say that we're trying to develop at the Royal London a environmental monitoring clinic, which will allow us to measure, monitor, and give appropriate advice based on real-time measurements. But we'll see if that gets set up next year. We'll be very good if we can report back about its effectiveness in the future. I think we've now come to the end of our session, so I'd like to thank the three other speakers. I hope you found it all very interesting. I would encourage you all to look at the asthma bundle when it gets released. I think think that'd be very interesting. And also the new WHO guidelines as a whole downloadable PDF, which I think will be very informative. So thank you very much, and goodbye.